Hello, my name is Kiki Hasselgren, and I have 30 years of experience in wound care. Absorbist is a Swedish company that specializes in developing and manufacturing medical technology products, primarily absorbent solutions including wound dressings. We are very proud to have our own production facility here, in a small rural town in the forests of southern Sweden. Nearly half of the raw materials we use to produce our dressings are responsibly sourced right here in Sweden. The remaining materials are sourced from other EU countries, while many wound care products now originate from China and other Asian nations. But we see great value in controlling and influencing the production chain ourselves. And we believe in simplicity, but the simple isn't always easy. But with greater knowledge and understanding of how dressings work, how their design can affect the patient's experience and daily life, and how specific properties in a dressing can help you achieve better wound care. So, our mission is to make it simpler to do the right thing, with knowledge and solutions that support you as a clinician in your day-to-day work. And today's webinar will be all about superabsorbent dressings and how they can simplify wound management. We'll go through the basics together, how a superabsorbent dressing works, and how to use it effectively to manage exuding wounds. How a dressing can support you as a clinician in creating simplicity and confidence in your everyday work, and how it will be most beneficial to the patients you care for. We'll top this off with a few useful folding tips. Simple, practical tips that show you how to fold dressings so they can work in the best way possible on exposed or tricky parts of the body. But more on that in just a little while. So, let's get started. First, I'd like to briefly describe the different parts of a dressing, simple examples of how a dressing can be constructed, and how these details in turn can affect the function and experience of the dressing, both for you as a clinician and especially for the patient. Historically, the edges of a dressing have often been uncomfortable for patients because they have been stiff and hard, especially when they become wet or are used under significant pressure or compression therapy. But hard edges have generally improved over time. But look at and feel the dressings you use, preferably in both wet and dry conditions. Take the dressings from the cupboard and put them in a bowl of water. Let them sit there for a while. The water in the bowl simply represents exudate. Then feel them again and squeeze them. There's a difference in how a dressing feels when it's unused and dry compared to when it's used on a wound. You'll notice some interesting things. Just a tip from me. Because we have our own factory, we have greater control over the production process and can respond quickly to your clinic feedback. A key priority is to create dressings that are soft, flexible, and highly comfortable for patients. And of course, they must also be effective and foster the best possible environment for wound healing. But how do we approach the design and composition of a dressing? And how do these factors influence the patient's experience and the healing process? If we look at this dressing, our own superabsorbent dressing, it is designed as a tube model. This means it has only 2 edges instead of 4. From a patient's perspective, there are fewer edges that could cause discomfort. The dressing also has rounded corners for added comfort. If the edge is completely straight and the adhesive is right at the edge, it can become stiff and almost pointy at the corner, which may cause skin irritation. Another very important component is the dressing's core. It's not something you can see, but you can feel it, how soft and conformable it is. A soft, flexible dressing provides better skin contact, fewer creases, and a lower risk of leakage. Leakage often occurs precisely in the folds, which act as channels for fluid. That's why softness and conformability can be essential design characteristics for dressings. And this is where the test of putting the dressing in water becomes very interesting. How does it react in water? Let me remind you again. Try it out and compare with the dressings you have. That way, you'll get a sense of how it feels for the patient, for example, during compression therapy. The key here is to keep the surrounding skin dry by having the dressing absorb and lock in the fluid. This is often referred to as retention, to use a fancier term. For example, this helps minimize leakage and odor for the patient and creates a favorable moisture balance in the wound and surrounding skin. If you compare it with a standard gauze dressing, for instance, which you might apply to an exuding wound and then cover with compression bandaging for pressure therapy, it can end up acting like a dishcloth. It absorbs the fluid but leaks it back out when you squeeze it. If you use that kind of dressing on an exuding wound, you make it harder for the wound to progress from the inflammatory phase to healing. Don't forget, the wound should be moist, but not too wet. And with the right dressing that controls exudate, the wound can heal undisturbed, allowing you to focus your time on other important aspects of patient care. Sometimes the question arises whether a superabsorbent dressing can be used as a primary dressing. Yes, it can, provided it is sterile. We recommend this for exuding wounds, as it can reduce the risk of maceration and benefit the surrounding skin area and healing. If you use another product directly on the wound and a superabsorbent dressing as a secondary product, you risk the wound surface remaining too wet because the product placed closest to the wound cannot absorb the excess fluid. This in turn can affect the wound, as exudate in the wrong place can impede healing and lead to complications. And as a clinician, you end up spending time on resource-intensive dressing changes. Can a wound dressing become stuck? Yes, of course, that can happen with any type of dressing and any type of wound. Wounds never look the same. Part of a wound may have a lot of fibrin and quite a bit of exudate. The other part of the wound may be in the proliferation phase and not have as much exudate, but you want to manage the exudate from the so-called fibrin side, which is inflamed. If you don't, you risk disrupting the part of the proliferation phase. But if the dressing gets stuck, moisten it to make it easier to remove. Now, let's move on to some very practical and useful folding tips. How to fold dressings and apply them to parts of the leg and foot that can be tricky to manage, or are particularly at risk when dealing with large volumes of exudate on leg ulcers. We'll start with a small superabsorbent dressing, 5 by 5 centimeters. Very useful, for example, when you have problems with lymph leakage between the toes and need to apply compression therapy, starting from the tips of the toes. Here, you don't really need to do much folding at all. The small size, combined with the soft, conformable dressing's flexibility, is very practical for use on tight body parts and small areas with a lot of exudate. Here we can see how the small dressing simplifies dressing changes. As a caregiver, you can also let the superabsorbent dressing handle larger amounts of exudate, reducing the need for frequent dressing changes. Another important reassurance and benefit is that the absorbist, superabsorbent dressings we use here don't have a specific front or back. They absorb from both sides equally well, so you absolutely cannot go wrong. From the patient's perspective, it's also more practical to have an adapted dressing size that doesn't become too bulky when used with compression stockings or bandages. The patient can find it easier to wear shoes and to engage in more activities, which promotes healing and long-term recovery. Here, we are using a dressing, 10 by 20 centimeters, and we are going to fold it around a heel. If you have a leg ulcer that is exuding around the ankle, we recommend a superabsorbent dressing to manage the exudate, as there is a risk of it running down the leg and collecting around the heel. We also chose a superabsorbent dressing because it performs well during compression therapy when placed under pressure. Here, the purpose is to catch exudate when it runs down towards the heel and foot. When the dressing absorbs fluid and locks it in, the risk of macerated skin on the heel is reduced. Maceration can affect the skin and disrupt the wound healing process, which in turn can increase the patient's experience of pain and discomfort. If instead we use a larger dressing to cover a larger wound area on the lower leg, size 37 by 56, you can fold it into a boot shape. Here as well, we use our super absorbent dressing. It doesn't have a front or back, so you can feel safe and not do anything wrong. And again, we want to reduce the risk of maceration on the heel and under the foot. The large size also helps avoid patching together several smaller dressings for a larger wound area, which can, in turn, cause chafing and, in the worst case, new wounds. Practically, managing multiple dressings and ensuring they fit well on the leg can be challenging. Additionally, using multiple dressings increases the use of disposable materials, which may be unnecessary. If you fold the dressing so the layers overlap, the fluid will enter the dressing and then pass into the next layer. This is possible because there is no front or back. We place it under the leg, folding the dressing in from both sides at the ankle to cover the foot. Continue folding the dressing up around the entire leg. Make sure the wound area is covered. Use tape to keep the folded boot in place. Here, it's important to choose a tape that doesn't irritate sensitive skin. You can also try removing the tape once the fold is in place, or taping only directly onto the dressing. Pull a tubular bandage over it and secure the dressing with a sock. In our webinars, we aim to provide both knowledge and practical tips to help you create simplicity and greater confidence in your wound care work. To support you in performing your duties more simply and delivering the highest quality care to patients. And bear in mind that a very important aspect is always to make a diagnosis of the underlying cause of the wound. We must never forget that. But when we talk about supporting wound healing, the choice of dressing can matter, as it can influence how the wound heals over time. As we mentioned earlier, the properties of a dressing can affect the overall treatment process. When you're dealing with a wound with lots of exudate, it's important to choose a dressing that effectively manages it. For example, during compression therapy, a sterile superabsorbent dressing can be used as a primary dressing because it is designed to absorb large amounts of exudate and retain it within the dressing. Properties that can help manage exudate and support a balanced and moist wound environment. This in turn can extend the intervals between dressing changes, saving you time, reducing healthcare costs, and lessening the patient's suffering. Making wound management more sustainable for both clinical practice and patient well-being. So, that brings us to the end of this session. Thank you for taking the time to join me. I truly appreciate it. And I hope you're leaving with a few practical insights and perhaps one or two ideas you can apply in your daily work. And if you found this helpful, please feel free to share it with colleagues who might benefit from this knowledge. And if you have any questions, just get in touch. We're happy to help. Also, if you want to download our folding tips, you'll find them on our webpage. If you would like to try our dressings firsthand and compare them with your current options, please request complimentary samples. We send them to healthcare professionals at no cost. And most importantly, thank you for the work you do every day. It really does make a difference. Thank you again and see you soon.